So we will be publishing on Monday some of the events and topics that we will be organising events for over the course of the year to come. There will be big events around climate change and climate finance, which is the #1 issue that our parliamentarians have told us that they want to talk about. But we'll also be talking about issues around corruption, issues around cryptocurrency, and then the traditional meat and drink of our work around jobs, small business, health, education, and then that challenge of how we mobilize the resources to close the development gap that we've got. So what do we do about debt and debt sustainability, tax, and how do we make sure that we've got a much stronger partnership with private sector asset managers whose resources we're going to need to help us make progress. We thought, however, there was one place that we needed to start our Global Parliamentary Forum this year. And that is to send a very clear message that we know that the COVID crisis is not over. For many countries, there is still lives and livelihoods that are being lost. But crucially, as we begin to emerge from the pandemic and set our sights on the deadlines of the Paris Climate Agreement in 10,500 days' time, it is absolutely critical that we remember those that we have lost, we remember the people that we serve who are with us no more, and we think hard about the lessons that we learn so that we don't make the same mistakes again. That's why at today's event, we're delighted to bring together the Unite Global Parliamentarians Network, which has been such a driving force for progress. And our Vice Chair, Ricardo, is going to say a word about that in a moment. But I'm also really delighted that joining us today are key participants from the International Forum on Health, from the Global Public Health Convention, from the Global Fund to fight HIV, AIDS, tuberculosis and malaria, as well as people from the Unite Network around the world. So look, we know that many of the deaths that have been caused by this pandemic were unnecessary. We know that the world, frankly, was not prepared. And so we've got to enshrine a different set of principles for the years to come. And we've got to work much harder to mobilize the resources to help to turn those principles into change on the ground. So we've got a great lineup of speakers tonight, this afternoon, this morning, which I'm going to hand over to in a moment. We have our Young Parliamentarians event tomorrow. So I hope for those of you who are young or feel young, you will be able to join us for that. And then we have our big town hall with Kristalina and David Malpass on Monday, plus our final couple of events next week. So have a look at the Parliamentary Network for the programme of events. We'd love to see you on some of our events, and we're going to be asking you to help us share information as we build on our digital platform that we've created over the last couple of years to do an even better job at sharing some of the news and views that we talk about in the network. So our day today is divided into two. So in our first session, we are going to hear from Ricardo, who's going to set the stage. And then I'm going to hand over to Dame Barbara Stocking. Barbara, so good to see you again. And then my old friend Angel Gurria, brilliant that you're here with us today. And then we're going to have a bit of a debate and a discussion. Please just use the raise hand function or post your questions in the chat, and I'll do my best to bring you in. And then we're going to talk about money. And I'm really delighted that we have got both Priya, Head of Development and Finance, and Scott from the Global Fund, who are going to help us lead off. And I am unfortunately going to hand over to one of my colleagues, Nima, at 4:15 my time, as I have to catch one of these excellent Swiss trains which are outside the window. But without further ado, Ricardo, let me hand the floor to you and salute you and thank you for such an incredible job of leadership, helping create the Unite Network and lead it forward. Over to you.
Thank you so much, Liam, and it's a great pleasure to be among so many friends and to follow in Liam's footsteps as his vice chair here at the Parliamentary Network on the World Bank and IMF, and to see so many friends here in this important session. And so I'd like to start by greeting our esteemed colleagues, members of Parliament and partners, and to say that it is an honor to deliver the introductory remarks for this important roundtable, to which I thank you all for joining on the role of parliamentarians in promoting pandemic preparedness and response. And as Liam was saying, this is co-hosted between the International Forum on Global Health, which we helped co-create, the panel for a global public health convention, the Global Fund to Fight HIV/AIDS, TB, and Malaria, and the Parliamentary Network, of course, the World Bank and IMF, along with UNITE. I am honored to be here and to introduce our debate, which in the times we are living is more important than ever. Indeed, we have faced many challenges in the past 2 years as the COVID-19 pandemic has truly overwhelmed our health systems and societies. The restrictions to contain the virus spread brought a disproportionate impact on low-income households, women, key populations, and those living with other infectious diseases. At the same time, the pandemic exposed the profound economic and social inequalities, the inadequacy of investments in public health, and also the fragility of our global system. However, I would like to say that we also have many reasons to be proud. There has been unprecedented collaboration on many fronts, with different sectors and stakeholders taking accountability for health. And now more than ever, governments acknowledge the real importance of health. But while much of our focus remains on responding to the current global health crisis through the equitable distribution of vaccines and therapeutics, we must put our collective efforts into preventing a future pandemic. For the world to be prepared, the best solution is without doubt a global treaty or convention signed and overseen by its heads of states and government, who must renew their commitment to multilateralism and create an effective global architecture to direct and coordinate all aspects of pandemic preparedness and response. At the December 2021 special session of the World Health Assembly, a historic decision was reached to launch the process to develop and negotiate a global agreement on pandemic prevention, preparedness, and response. There is no better moment than now to negotiate a pandemic convention that can deliver on the promise of preventing future pandemics from devastating the world again. And it is imperative that this global health architecture reform embraces principles of solidarity, equity, accountability, and transparency to effectively protect the world from pandemic threats and build stronger and more resilient health systems for the future. At the same time, and considering the huge impact of this pandemic and infectious disease in general on people's rights, this legal international mechanism must include a human rights perspective, fundamental to prevent abuses witnessed in the context of COVID-19 pandemic response worldwide, especially the misuse of emergency powers and the exacerbation of inequalities. However, for this very much needed mechanism to become a reality and to become effective, we all must invest. We, as members of Parliament, are at the center of this process as we can advocate for more efforts and investment in pandemic preparedness while holding our governments accountable. Simultaneously, our work is key in the much needed multilateral response, as no one is safe until everyone is safe. For this reason, UNITE and the Parliamentary Network on the World Bank and IMF, within the International Forum on Global Health, decided to host this discussion with members of Parliament to understand what it will take to achieve accountability in the new legal framework for pandemic preparedness and response, as well as to hear what parliamentarians think a good mechanism is to finance this purpose. We know that 2030 is just around the corner, and improving our global health is a long-term effort. It demands continuous dedication from us all. For this reason, we call on parliamentarians all over the world to show their commitment and take concrete action for improving global health while promoting epidemic preparedness and response. The time to act is now, or as we like to say at UNITE, it's time to unite. Thank you very much, Liam.
Ricardo, thank you so much for setting the stage with such clear, with such ambitious and such a compassionate set of remarks. Now, it's a real pleasure to introduce an old friend, Dame Barbara Stocking, who is going to share some perspectives. Barbara, you're, I think, now with the panel on Global Public Health Convention. So let me hand straight over to you.
Thank you very much indeed, Liam. And it's a real privilege to have the chance to talk to you all, and a real opportunity, I think, to, because it was, as Ricardo has said, you can play such an important role in making what we need to happen. But let me start from the beginning. Why was it that we couldn't stop this outbreak of COVID-19 becoming a pandemic? And I'm very brief on because the analysis has been done all over the place, but basically we weren't prepared. We didn't act immediately at the time of the outbreak in February 2020. We lost a month then. And different countries did not follow WHO's guidance at all. So we're now in a position where we are still at risk from a future pandemic. We haven't got it all sorted out yet. And yet we know that there are hundreds of thousands of viruses that could transmit from animals and birds to humans, and then onward human transmission. And a real nervousness that could happen at any time now. So we really need to get our act together and get this sorted out. So it's those reasons that we think that there really has to be a pandemic convention. And I'm going to go on and explain a bit more about what we're going to do on what's needed to be done on some of those things. But fundamentally, as has already been mentioned, two of the absolutely key elements of this are accountability and also the financing for preparedness and response. Now, I'm going to talk a bit more about accountability, and I'll hand over to Angel Gurria, my very distinguished colleague on the panel, to talk a bit more about the financial side. But let me start really from where Ricardo began, which is that we've set out that we really believe that a new convention, a pandemic convention, has to start from these real basic principles, 4 principles. And to expand a little on Ricardo, solidarity. We have to have solidarity across the world because we are all in it together. Now, that's not just a positive moral position. It is actually also in our self-interest. If we don't act in solidarity, we just see this thing as we've seen it going round and round and continuing. The second one is equity. We've all been thinking for, worrying during this whole 2-year period about equal access to tests, vaccines and treatments. And clearly there must be equity in what is happening there on these global public goods. But when we say equity, we also mean that there ought to be processes in whatever the governance structures are, including finance, very importantly, where all countries are included in decision-making, a much more equal way of going about handling things. The third one is about transparency. Transparency in itself is actually about trust. If you're transparent about what you're doing, you're more likely to have trust from other countries in what's happening. And just a reminder, the sorts of things that we want in transparency, clearly we want very rapid reporting at the time of outbreaks. We need to share data then and throughout, and we need specimens to be shared so that we can do the genetic analysis and keep working on treatments and vaccines. But that moment of outset of an outcome and then a pandemic, though, is very critical on transparency. And the fourth one is this issue of accountability. And we say accountability here because during this last pandemic, the international health regulations have not been adhered to by countries, nor has WHO guidance. And that's one of the most fundamental reasons of why we got ourselves into such disarray. So in talking about this, countries that I talk to would say to me, well, what is it we're supposed to be accountable for? And the first part of it is preparedness. And it's not just good public health systems, it's about systems across government, because we know how widely this affects. But it's also not just having good public surveillance systems in place, because although some countries had those, they simply didn't act at the moment when they should have applied those public health measures and got on with it, really. So people have got to look at this in a rather different way. We need different indicators. It's shocking that the people who should have rated very highly in having pandemic preparedness didn't actually do very well at all. And I think that's because it was a very sort of system in place rather than people who are actively thinking about it and actually practicing it with simulations and so on. So the preparedness is one thing. And now what we're proposing as a panel is that because countries are at such different stages and have different financial capability, a bit like the Paris agreements on climate change, they ought to come forward with 5-year plans about how much they can realistically, but ambitiously, move towards full preparedness. And that clearly is going to require finance. That's a very big part of the financing that's required. But we also feel that that preparedness has to be independently assessed. At the moment, we have peer reviews. I mean, peer reviews are fantastic for learning and development, but we don't have a means of doing an independent assessment of where we really are. And I will come on to the mechanism for that in a minute. But the other things that we need people to do, well, obviously the things they need to be accountable for are these issues around transparency. They need to be accountable for action on the warnings when a fake is called and so on. And they need to be accountable for the actions they take, the public health measures. I mean, the good standard historic understanding of how you stop outbreaks, which is test, contact, trace, and isolate, seems to have been lost somehow in the fear and the suddenness of everything that happened. And the other one that we're clear about in terms of accountability is delivering equity, particularly in those global public goods. So for us, thinking about how the assessments are made, how we know where we are, how that accountability is done, is really in two parts. One is the preparedness part, which I've talked about, which is longer term. You can see that happening over time. You could imagine an independent assessment body doing the reviews over a staggered period of time. But that's, although incredibly important in its own right, it is not the central issue about accountability. Accountability and assessment is about the time of detection of a virus, alert, immediate response, and ongoing responses, really. And that's where we think an independent body would have its most important role, to catch things very early on, to be able to go into countries and assess the situation, to expect countries to take remedial action, but also to be able to say publicly either praise or criticism of what people are doing. We need to have that really out and in the open if we're going to have that mutual assurance from one country to another to get on and deliver. And you need that mutual assurance because it's, as you know very well, it's very difficult for countries to take very difficult measures with their populations if they look across the border and think that other people just aren't doing those things and are keeping the pandemic going. So we really do believe there needs to be an independent monitoring, verification and assessment body. Doesn't necessarily need to be huge because WHO, who are the main standard setting body, will also have a great deal of information in terms of monitoring. But we think it needs to be at arm's length of WHO, because WHO, of course, is the friend of the country, the supporter of the country. It has staff of WHO in country, and it's quite difficult for them to be both the friend and also the person who is the assessor, the critiquing, really. But we do think it's not a body that's just standing alone outside. It's clearly got to be part of the convention, the treaty structure, and that wouldn't be very difficult to have a body like that. With everybody's agreement, of course, which is more difficult to get, but under the conference of parties that would be needed to actually run and have full oversight of a pandemic convention. So that last one is probably the most sensitive of suggestions that we're talking about, because countries are very nervous about being accountable to independent bodies. But we really think we need this. This is not just a small thing, as you know, that's happened. This is not just, it's been absolutely shattering. But again, it's that point that we haven't got through it now, and we also are at such high risk for later. So I'm going to stop at that point and let Angel Gurria pick up and talk a bit more detail. Obviously, we're talking with IMF and World Bank colleagues here, so it's really very important now to think through these issues about how are we going to get the money and structure the delivery of finance to make what we're talking about, the prevention and preparedness and response, possible. So I'm going to hand over to Angel at this point.
Barbara, thank you so much. That's a brilliant introduction. Angel, let me hand the floor to you. It's a huge pleasure to see you again, and my opportunity to introduce you gives me an opportunity to salute your extraordinary leadership of the OECD, when we made such fantastic progress championing the work on inclusive growth, and I hope you're pleased to see the influence of your work in the frame that we've set for the Parliamentary Network's work programme for the next couple of years ahead. We put inclusive growth right at the heart of the discussions that we want to have, and we know right now that that entails making a hell of a lot more progress on the kind of pandemics that we've had to deal with over the last year or two. So, Angel, let me hand the floor to you. Sorry, you're muted.
Yep. Parliamentarians, and parliamentarians. This is what we thought at the OECD. And as you know, we've been working on not only the Parliamentarian Network of the OECD countries, but when we get together, actually we do so several times a year, and we have now upwards of 100 countries that are represented. More and more come every time. So why? Because parliamentarians are increasingly important in decision making, because not only is it where final legislation is sanctioned, but where the ideas originate, and where the needs originate, and where the political parties come together to agree on some of the fundamental issues. Now, when we talk about financial needs, how much has the world thrown at the COVID-19 pandemic? Well, it's by certain accounts more than the totality of the US economy already. That means upwards of 20 plus trillion. Now, the unit is important here, Liam and dear friends. It's trillions. Now, what are we talking about in terms of what is required to make it a better world in terms of solidarity and equity and transparency and accountability when it comes to finance? It's in the billions. That means with only a fraction of the amounts that have already been spent, we can create better health systems throughout the world, and we can make here the question of equity is particularly important. Why? Because if there's something that has become dramatically evident, is the question of the inequalities, not only in the health systems themselves, but also, of course, in the remedies that mankind has available to be able to, if you will, cover those inequalities, to address those inequalities, to have financial flows that have to do with the need. It's been dramatic when it comes to vaccines. When in the developed world, well, practically everybody who wants to be vaccinated has been vaccinated already, and we have low, single digits, in some cases, low double digits in terms of the developing world. How can we design mechanisms that will provide finance according to the size of the need? Again, it's in the billions, so it's a fraction of what has already been spent. Now, there was a word, investment, invested. Ricardo said we must invest. I would say that is the proper word, because it's not about spending, but it's about investing, and it's about investing for the future, for future generations, to stop the next big one. There's a sense of urgency that has been developed by this pandemic that did not exist, and I think that I agree with Liam, with Ricardo, that yes, there's been progress in terms of the awareness, but the mechanisms we have put in place do not seem to be of the same stature, of the same importance that of the lessons that we have learned. There's also a question of how do you adopt finance that has solidarity in it? Well, by definition, by giving, by making sure that the poorest, the most vulnerable, have the availability. You go for the equity again. You go for the transparency, but then about the accountability. Again, Barbara has mentioned about the accountability is about the moment there is an outbreak, the timing of the outbreak, the reporting of the outbreak. But how did we react the last time a country was totally candid and open? Well, take the case of South Africa, where it got blocked from the outside world and had to fend on its own for quite a while. Now, that was the best example of how not to react, and also how a country should think twice today under the present circumstances about being transparent and about being in giving the right, the timely signal. We are taking away, actually, by our responses, we're taking away the incentive for countries to actually be transparent and to be timely and to immediately report the outbreak. But it's still true that we need it. We absolutely need it, and that we need the preparedness, and that this idea of having 5-year plans, which is the beauty and the wisdom of the Paris Agreement on climate change, of course, is, and Liam said, we're going to have to continue to work on this because we cannot forget it. Now, we've had the pandemic and we've had Ukraine, so and they take away our attention. So please, Liam, absolutely, just keep at it. Remember that. Remember, our most urgent requirements is to deal with the pandemic, but the more important intergenerational responsibility that we have is, of course, to the planet and to protect the planet for future generations. And that has to do with climate change. So absolutely. Now, having mentioned some of the fundamentals, as I said, what we're trying to do here is to have institutions like the World Bank, like the IMF, like the regional development banks, but also the countries themselves, organize in a way in which there can be a system that is responsive, and that is responsive depending on the size and the urgency of the needs. And that, again, it takes, because when you have the system, actually, as the countries themselves strengthen their own internal domestic systems and institutions, that when we have the time, when we're not confronted with this brutal urgency that we were with a pandemic, they will, in the course of things, continue. Everybody has learned that they have to continue to strengthen the financial systems, and they will do so with a number of instruments that are well known. The question is, what do we do when we face the next situation, and when we know what went wrong here? How do we pick up the lessons? How do we get together and organize that system, that fund that will be able to produce the right amounts? Think about what has happened so far. We have been responding to the very urgent needs of a number of countries, more than 100 so far, and we're now going into, again, the trillions in terms of the amounts that the IMF and the World Bank and the regional development banks have provided. But why are we going into the trillions? Because we did not spend the billions in the prevention. So the question of preparedness is a question of billions. We already know it costs 6, 10. Now we know, and sometimes it costs 100 times more when we have to stop the pandemic rather than prevent it, rather than strengthen our health systems, and rather than make sure that we have the health teams, that we have the doctors, that we have the nurses, that we have the paramedics, that we have the ambulances, and that we have the research systems, and then that the research systems produce a process which can then be shared, where the knowledge can be shared. That is another case where we failed miserably this time around, simply because even if we would make available all the formulae today, we would not be in a position to ensure that the countries are going to be able to put that in people's arms because of the lack of infrastructure. So we know what went wrong. We learned from the lessons of today and the lessons of yesteryear also, which can teach us a lot of lessons. And we, the collective that we are, the number of institutions that we represent, and the number of NGOs, and the number of the panels that, like the one that we are, like Unite, but the parliamentarians, I go back to this, the parliamentarians who represent the people, who represent the most important of all of us, the people, and who are the ones who have seen the suffering. So, Liam, thank you very much.
Thank you so much. That's a brilliant clarity, in particular, about the scale of the prevention that we need to put in place in order to save not just the lives, but the costs that we've encountered. Now, I see 3 hands. Please put your hand up if you want to come in on this session. I'll take each in the sequence that I saw you, and then if we've got time, we will go back to our panelists. Nima, can I bring you in first, then MJ, then Professor Millat, and then Dr. Amar. Nima, over to you.
Thank you very much, Honorable Liam. Greetings to everybody. I just have a few points, but I'll quickly go through, mindful of time. First of all, I wanted to truly congratulate the panel for Global Public Health Convention that is led by Madam Chair Dame Barbara. And particularly, I was quite moved to see that one of the non-negotiable principles is equity. I think with all of you would agree with me, COVID-19 showed the disparity of equity, especially with COVID vaccine. And myself coming from Tanzania, a developing country, we experienced a lot of challenges in that space, which were due to equity. So I was very pleased to see that is one of the non-negotiable principles. Now, just very quickly, I think COVID-19 gave us all a huge wake-up call in terms of how our public health systems need to be strengthened. And I just wanted to quickly highlight, on top of what everybody else said, I think it's likely there'll be another pandemic in the near future, and we need to get prepared now. But to do that, we have to look at how do we strengthen the community health systems, the community level, because we have examples from 2013 Ebola crisis and even the COVID-19. It's the local communities that usually find out about these outbreaks first, and they're the ones who can quickly reverse and block these block the spreads, stop the spreads. So whatever that we're looking at, if we don't look at the local community level, we're not going to be able to strengthen our health systems. So I just wanted to stress on the importance of making sure we look at the local. And then the other thing, lastly, is there are existing platforms, for example, interventions for malaria, intervention for tuberculosis, interventions for neglected tropical diseases. So instead of coming up with new intervention, we can see how to strengthen the existing platforms, because communities are already trusting to those systems, capacity building for health workers. And lastly, I see that we're calling for some sort of preparedness fund. I think this fund shouldn't be for selected diseases, but rather it should be, it should cut across the entire SDG. To conclude, yes, parliamentarians will have a role to play, but do we have the right capacity to be able to advocate and call for actions from our governments on these sort of, the global health issues and the terminologies? So perhaps there's a need for, parliamentarians to get capacity building, especially from developing countries. Thank you so much, Honorable Liam.
I'm so glad you made that point to finish on, because that is absolutely something that we want to try and grow and develop with the Parliamentary Network. Our task as a network is to help each and every one of us as parliamentarians do a more effective job for the people that we serve and the countries that we represent. MJ, you're next. Over to you.
Greetings. Thank you, Liam, for this opportunity. And again, as the Unite Regional Chair for Eastern Europe and Central Asia, let me first fully endorse the call for action of the Global Health Convention panel and the principles outlined by Barbara for the new treaty. As the former Deputy Health Minister and the President of Innovative Financing Leading Group, let me focus on 4 major lessons we've learned and what could be our next steps for strengthening the global health architecture. First, we've seen that unfortunately the international health regulations have not worked. Enforcement of IHR remains de facto voluntary by the member states and the respective national health authorities. Second, despite daily reporting of COVID morbidity and mortality, the quality and transparency of data still remained questionable. Third, WHO was consistently providing guidance to countries how to act, but there was no independent national or international monitoring instrument to ensure adherence of the country response to the WHO guidance. And this was especially alarming in middle and low-income countries with fragile democratic institutions, since we've seen non-transparency of data management and decision-making, and unfortunately, the restrictive measures that were not free of political influence. Finally, despite unprecedented mobilization of COVAX and other platforms, the pandemic relieved major inequalities in access to financial and technical resources and even aggravated the existing massive inequality gaps globally. So what we have learned and how we can act for a stronger global health governance. Let me underline that the leadership role and the guidance of WHO will definitely remain critical as the major global health authority. But the existing rules and regulations of WHO, plus political and financial dependency on the member states' contributions, would not allow WHO to host in-house a stronger or more effective global health monitoring instrument. We need politically and financially independent platform for stronger global health governance that could ensure external validation of data and decision-making, as well as transparency of the leadership. This new global platform could mobilize the expertise of the highest credibility at the international level and be based on the principles of shared global leadership, solidarity, and accountability. Finally, in terms of financial aspects, we've seen, based on the Global Fund and other global public-private partnership experience, and their engagement in major infectious disease control and health system strengthening portfolios, Global Fund could be definitely one of the main financial instruments that we could explore, at least at the initial stages. And in parallel, we could explore innovative approaches such as results-based loans and grants from World Bank, IMF, or other regional institutions, as well as exploring activation of the 4th article of the IMF Constitution. Thank you, and again,
thank you so much. Just underlining the point that there's so much expertise in this network that we can share over the months to come. Thank you so much. Professor Miller, over to you. I think you're joining us from Bangladesh.
Thank you, Chair. Yes, I'm from Bangladesh. Thank you very much. And happy Bengali New Year that will be starting tomorrow.
Yes, to you too.
Thank you. I want to tell you some success story. I know the global leadership, but also that you need local leadership, country-wise and also locally. As you see, Bangladesh is a densely populated country, 180 million people. You will be surprised to know that only COVID identified patient, the number was 1.95 million, that is just over 1%, and death was under 30,000. It was possible because of the leadership and also high-level political commitment, especially around Prime Minister Sheikh Hasina. As you know, so far, country like developing country, low-income country, we have covered more than 70% target population with the vaccines. We had collected, of course, we got help from COVAX and other countries, but the leadership has to manage, and we collected about 250 million vaccines. And second dose was given more than 50% of the target population. I think we have to think about the fund, we have to think about cooperation, but when we're in trouble initially, Bangladesh bought vaccine from one of the company, AstraZeneca India. But because of the India, we have so many COVID patients, they didn't supply any vaccine to us. We're in trouble. But our diplomacy works, and we got 250 million vaccines. And also I can say that I know the time is very short, but of course we want support, we want help. But first of all, if any crisis, we need to manage it locally and efficiently, we have to manage that. And also, we shouldn't forget not only this pandemic situation. Because of this pandemic, we spend almost $5 billion from our country. We will suffer from lack of education. We'll suffer from other priorities. But to save our people, we have to spend that amount of money. We have done that. Also, we shouldn't forget non-communicable diseases, which is spreading all over the country. And other than COVID, in single most killer disease are those non-communicable diseases. We need to look at that as well. So I think, of course, WHO give us the guidelines, IMF, World Bank has poured some money in different countries, but still in this pandemic, many countries are not having vaccines and many countries are wasting their vaccines. So we need to get equal share. Thank you.
Yeah, no, and thank you for underlining that basic injustice, which is still scarring our world. Dr. Amar, over to you, sir. Senator, I see, yeah, we go to Dr. Amar first.
Oh, thank you so much, Liam, for this opportunity, and thanks to the Global Parliamentary Network, UNITE, and the Global Health for organizing this. I just would like to flag a few issues which I thought has not been discussed. One, I think, which is very critical, we have been talking about equity. Equity is the bedrock of success in this entire prevention paradigm that we are going to build. But there are two issues about equity, which is the intra-country inequity, which already exists in the health sector. And the other thing is the global inequity in access to handling the preventive aspects of health pandemic in future. So I think, the WHO has talked about standards as this many number of doctors for this many number of the size of population. This is the number of paramedics. These are the number of nurses that one should have. But I don't think those goals are being monitored. These goals are being achieved. And unless and until the intra-country or intra-nation equity is achieved to some extent, the preparedness for future pandemics would always be suffering. And as my friend from Bangladesh said, it would also have an impact on the other diseases that would probably be there, the non-communicable ones, which are also happening simultaneously. So I think we have to think about intra-nation inequity as well as the global inequity. In the global inequity, one has to talk about even till now, the relaxation of the TRIPS and the TRIMS, which didn't take place for vaccine production by the developed world. Despite demands from India, South Africa, New Zealand, I think we have to have a global consensus, and that at some tipping point, one has to give a go-by to these regulations, which are, of course, necessary in the normal circumstances for protection of intellectual property. But if someone has come out with a vaccine earlier, then I think these rights have to be given for a larger global interest. The last point which I want to make is relating to the redundancies, the reserves that Mr. Guria was talking about. One is having the physical infrastructure, but if you have an infectious disease, and if Omicron was as lethal and with 30 times more infectious value, then the people who are actually giving the vaccines, the people who are actually looking after those patients, they are the nurses, they are the paramedics, they are the doctors. If all of them in a size of country like India with 137 million, 1.37 billion people, 50% or 60% get down themselves with the pandemic, then what happens to giving health service delivery? So we have to, I think, more important than the physical infrastructure, we have to think about building this reserve of human resources, particularly the paramedic who have to put that injection into the body or put that mask onto the so that's the second point. The third point I wanted to make is relating to data quality governance. I think Maria made a point relating to that. It's very important to have a uniform global standard for data quality relating to reporting of mortality, reporting of infections, reporting of the figures, under the garb of audit. I think we need to report figures very early on within a time frame if you want to get your model right as to where the geographically the next peak is going to happen. And this is very important in countries like the size of India. I think if you delay these figures, the model itself goes wrong. So this is where I think we have to have an international global agreement, and WHO probably or any one of us could actually take the lead on this. These are the few points that I wanted to make.
Really helpful. Right, I've got three more colleagues who I'm going to try and squeeze in the next within the next 5 minutes. Right, Senator Bakri, can I go to you first, sir?
Merci beaucoup.
Thank you very much. I wanted to react on what was said, specifically on transparency. I think that it is one of the basic lessons, and we have to, it relies on trust. And that's why I would like to go back on a few points that we were quite uncomfortable with during COVID-19. It's the notion of fake medicines and fake vaccines. Here in Africa, we had problems with vaccines, specifically the AstraZeneca vaccine. We had agreed the vaccine was not recognized internationally, and some African countries got the vaccine, but the vaccine was not recognized when they left Africa. They traveled outside. And I think that's a problem in terms of equity. If we take vaccines that are recognized in Africa, but not by other European countries, it's problematic. And that's why I agree with the implementation of an organism to monitor and follow up the guidelines and their implementation, because if the WHO gives guidelines but they are not respected, well, it's a problem. So transparency is important, and we have to ensure that every country respects the guidelines of WHO. Otherwise, it will be problematic for us countries that are not necessarily on the same level of development. And I also wanted to go in the direction of investment. There's one point that's really important. It's investment in research. To prevent future pandemics, we have to invest in research. And I think that's very important to make sure we have all the elements necessary to implement new medicines, new vaccines. So we have to invest in research. And that's my plea here. I would like to, if possible, to make sure that we give more value to African medicines that people are trying to implement to generalize when there is a pandemic. So that's really something I want to say in the name of African researchers, because we tend to neglect those aspects. But I think if research goes in that direction, it would allow us really to make big progress. So I wanted to stop here because we don't have much time left. Thank you.
That's very kind. Thank you so much. Right, let's go to the Shura Council now with Regia Farage, please. Thanks again for joining us.
Thank you for allowing me the time. I want to touch on something else which is related to the future. I know this sort of pandemic, which hopefully is behind us or partly behind us, had caught us all unprepared. So therefore, each country had a system developed, a methodology developed, a style of management which was developed. So there are a lot of experiences in relation to how to handle a pandemic such as the one which we had to face. My suggestion would be for somebody like WHO to gather those experiences all together, prepare what sort of could be termed as SOP, a standard operating practice or whatever it's called, to cover all the issues which we would like the country to be prepared for in case of any pandemic, which relates to transparency, to accountability, reporting, keeping the statistics, all that, and train those countries, those sort of really countries who are not really that well off to be, or don't have the type of people who could handle with this, train them, monitor them. So whenever, hopefully it never comes, but if it ever comes, a pandemic such as the one which we had, there is a set of standard practices to follow. That would assist the countries all to prepare themselves and have a system in place which would be a sort of really covering the accountability, the transparency, the equity, all that sort of issues related to handling or managing or administering this pandemic or future pandemics. That's what I had to offer.
Lovely. Thank you so much. Dame Philippa Whitford. Sorry, Dr. Philippa Whitford.
Thanks very much, Liam. The place I would start is that this pandemic is not yet over. So maybe we should think of some of our principles and thinking in the ongoing next year or so when the pandemic will still be running. Particularly, we've heard about inequity, and the inequity around vaccines remains. There was a lot of rhetoric in spring 2020 about a global response to a global crisis. And our failure to do that doesn't bode well for what was mentioned earlier, the bigger climate crisis. So we really need to get our act together. And if you look back over this century and the 20th century, there has been an epidemic with the potential to become a pandemic in almost every decade. So this is not, we might have another one in 100 years. We will have one in the coming decade. And therefore, I think investing in universal basic healthcare needs to be looked at as part of the biosecurity for all of us. But I do think we then need to define triggers for when something starts to actually threaten a global crisis. And that should bring about researchers going in, it should bring about support to low-income countries. And I think that kind of response would encourage countries to be open. If they know they get help in exchange, then they would say, we have an outbreak of Ebola or we have an unidentified vaccine. And I think a TRIPS waiver is part of that. TRIPS is part of the normal WTO structures, but it does bode against low-income and developing countries. And in this situation around vaccines, most of the leading vaccines have been developed with major input of public money. So to then say we can't share them as public good that helps all of us is ridiculous. We quote that line, no one is safe until everyone is safe. We need that approach, and actually we need that approach now.
Very well said. And yes, the response since all the rhetoric last year has been pretty poor. Right, two more speakers. If you can be very quick, then we will get some comments very quickly from our panel to round up. Let me go to Lakram and then Mr. Alamgir. Thank you. Lakram first.
Yes, thank you very much, Liam, for the opportunity. I'll be brief, I assure you. Trinidad and Tobago is a small nation, 1.4 million people, and I just wanted to give that perspective and to say that as a small nation, we would be very much in support of this WHO initiative in terms of the global preparedness and so on, because the experience has shown that we weren't prepared. I just want to link one to the principle of equity and to say that in our own situation, the vaccines, of course, showed that that was the answer. And as a small country, we had difficulty in accessing vaccines. So I think the issue of equity and how we can build that into this new agreement would be important. The issue of transparency is also important. And what we learned in our country is that although the issue of transparency externally is important, internally it is also important. As Dame Barbara mentioned, transparency equals trust. And in our own population, there was the issue of trust, and that led to some issues. And in fact, also the issue of accountability. As we speak today, in fact, our parliament, I also sit on one of the parliamentary oversight committees. And today we are examining the report that was commissioned by the government into the overall management of the COVID-19 pandemic. Hopefully lessons can be learned from that as we go forward. So that is an example of accountability in the local context. I just want to make one more call, and that is really the need, especially in smaller countries where you have a democracy and you have adversarial politics, that you need to have and encourage a collaborative approach between government and opposition, to establish a really important response. But I just want to close to say that small countries such as ours really would benefit from this kind of global agreement. And of course, the challenge remains in terms of how we are going to be able to enforce, those agreements. I thank you.
Very well made. Right, I'm going to come to you, Barbara, in 2 seconds. I'm just going to bring in Mr. Alamgir first for our final remark from parliamentarians, and then we'll do a very quick wrap up.
I would like to make just 2 points. First, it is obvious that we have to make more investment throughout the world to make sure that this pandemic doesn't recur once more. And second, I would like to emphasize that whatever has been achieved in terms of research should be made available to all the countries. We should make sure that these are achievements of mankind and these are needed for this, for the safety of the mankind. And that way we have to go ahead. Thank you.
Brilliant. Excellent. Look, so as ever on these calls, we've done a tour of the planet in the space of an hour. Loads of fantastic points. Barbara, Angel, Ricardo, if I can ask you just to give us a minute in summary, because we've got a second half of the panel to get to now. And if you could underline what you would like to see parliamentarians do next, that would be super helpful as well. Barbara, let me come to you first.
Yeah, thank you very much. That was really fantastic listening to all of that. I mean, and very encouraging, because it sounded like so many of you were, you know, both understanding the problem, but having the same view about where we need to go to, which is, you know, was really great. I particularly liked the Nima right at the beginning, reminding us absolutely, and in our preparedness, we should really, really build in our local communities and local leadership. It's absolutely critical. So I think the real key thing is, can we please keep in touch with you? Can we please hear your voice? Because we do need you very badly, you know, to really persuade your governments that we need to keep moving on this. It's going to be an uphill struggle, and having you sort of there and being, you know, in partnership would be absolutely great. So, and I'm really sorry, Liam, to have to go. But
Thank you so much for joining us. Rest assured, this is going to be one of our key priority campaigns for the next year and a half. And for those of you who have not had a chance to speak, but perhaps thoughts have been provoked in your mind, please jot them down and write them. We have a great digital platform. We'll be doing a lot more to share perspectives from around the world. We'd love you to put pen to paper digitally, if that's okay. Right, Angel, any summary thoughts from you? Oh, sorry, you're muted. Sorry, Angel. Thanks.
There seems to be a common vision. There seems to be a common sense of mission. There even seems to be a common sense of ambition of what has to be achieved. We've learned a lot, very painfully, but the devil is in the details and in the way we put it together. And I would like to say, when it comes to financing, again, remember, it's about investing in order to then save money. It's investing to save. So what Philippa Whitford was saying about how to react, when to react, this all requires a system, it requires a mechanism, and it requires resources, but it will save money, money that we can invest in the strengthening of our otherwise quite weak health systems. Thank you very much. Brilliant. And like Barbara, we'd like to keep in touch.
Excellent, Angel. Thank you so much again. Ricardo, do you want to just wrap up this session? Again, please underline any points that you want to make to parliamentarians around the world about what they now need to do next to work with us to take this forward. Oh, we lost Ricardo. I fear we may have lost Ricardo. Someone is going to give me a message to see if Ricardo is still on. I think we may have lost Ricardo. Yes, we've lost Ricardo. Sorry. So you're going to have to wait a little while to hear what Ricardo has got to say by way of wrap up. So that takes us to the next half of the session, which is actually where Angel very helpfully left off. So two perspectives to kick us off on finance and how we're going to pay for some of the ambitions that we've talked about. Delighted that we've got Priya Basu from the World Bank, Head of Development Finance, who's going to start us off. And then we're going to go over to Scott from Global Fund. So for those of you who have got your hands up, please keep your hands up because I'm also going to hand the chair over now to my fantastic colleague from Tanzania, who's going to chair this next half of the session, as I now have to leave too. But let me hand over to Priya first. Floor's yours.
Thank you very much, Liam, and thank you all. It's a pleasure to join you today. Parliamentarians can play a very important role in bringing about change. And the opening speakers, Dame Barbara and Angel Guria, actually made a very compelling case for why we need to invest in our health systems, which was the topic that I was asked to speak about. So I will be brief. Just to introduce myself, I'm Priya Basu from the World Bank, and I wear several hats, one of which is that I head up the COVID-19 Task Force Secretariat at the World Bank, so very engaged in the current pandemic, but also thinking about what we've learned from this pandemic that can help us prepare for the next one. And the next one is not a question of if, it's a question of when. So COVID-19 has exposed serious weaknesses in health systems everywhere, as many of you have already mentioned, and particularly in low-income countries and lower middle-income countries. It has shone a spotlight on the need to strengthen capacities to prevent, prepare for, and respond to pandemics and other health outbreaks. And in fact, some of these weaknesses have been exposed by previous pandemics as well, by Ebola, by SARS, MERS, avian influenza, but not enough was done. And we just continued to fall into cycles of panic and then neglect. So really, it's now an opportunity to address that once and for all. The case for investing in health systems strengthening is clearer than ever, as other speakers have pointed out. More than 6 million people have died from this pandemic, and it's the official estimate. There are other estimates and studies that say between 16 to 20 million people have died from the pandemic. The World Economic Outlook of the IMF estimates that the economic losses, the cumulative economic costs from this pandemic would be about 13.8 trillion between now through 2024. And as has been pointed out, compare this with the costs of strengthening prevention, preparedness, and response. There have been many estimates that have been prepared over the past couple of years. We at the World Bank recently joined forces with the WHO to prepare an estimate of what it would take to strengthen the capacity of low-income and lower middle-income countries to become prepared for the next pandemic. Our estimate was that it would take approximately $31 billion invested per year over the next 5 years. That's 31 billion compared to the 13.8 trillion that this pandemic is likely to have cost us. And we estimated that of the 31 billion that needs to be invested, about 1/3, a little over 10.5 billion a year should come from external financing. The rest of it needs to be domestic investments. So, you know, the cost of investing is far lower than the cost of not investing, or the losses that come from not investing, not just the economic losses, but also social and human losses. As has been mentioned, pandemic preparedness, investing in pandemic prevention, preparedness, and response really needs to be seen as an investment with high economic and social returns. So when donors in the international community think about providing resources to low and lower middle income countries to strengthen pandemic prevention, preparedness, and response, they shouldn't think of it as aid, they should think of it as investment, collective multilateral action to invest in something that's going to generate high returns for everyone. The investment being a global public good. So what should be the focus then of this investment? That's also been mentioned. Our own work has pointed to, and we have submitted recently a paper to the G20 on this as well. There needs to be investments at the country level to strengthen country level pandemic prevention, preparedness, and response capacity. benchmarked against the WHO's international health regulations. That investment needs to go into disease surveillance. It needs to go into strengthening lab systems. It needs to go, very importantly, into community engagement, as has been mentioned. It needs to go into emergency communications and management capacity, health workforce capacity. So these are kind of the areas where the 10.5 billion that I mentioned, would go into country level strengthening of pandemic prevention, preparedness, and response. But then on top of that, we've also identified the need for investments in regional and global capacity, network surveillance, reporting, data sharing, regional laboratories, building R&D capacity, as was mentioned at the regional level, particularly in regions that have limited capacity, regulatory harmonization, and then to invest in capacity for coordinated manufacturing, distributed manufacturing, regionally distributed manufacturing of critical tools, vaccines, therapeutics, diagnostics, and also to invest in coordinated procurement and deployment of these medical countermeasures, because this pandemic has taught us, and as many have mentioned, there have been deep inequities, and the inequities have been, to a large extent, driven by the fact that many parts of the world did not have the capacity either to develop or procure these. And when they did procure these countermeasures, the poorest countries found themselves at the back of the delivery queue. So that is unacceptable. So one needs to have, much better sort of organized distributed capacity. Not that every country doesn't need its own capacity, but we need kind of, regionally distributed capacity that can then allow, all countries to be able to procure essential countermeasures in a timely way. We've also been thinking about how we can invest more in building regional PPR institutions, such as the one that Europe is developing, the European Health Emergency Preparedness and Response Authority. I know that the African Union has called for such a facility, so that would be another element of where we would invest these resources that we're talking about. So the World Bank, along with the WHO and others, have been arguing for a new dedicated multilateral financing facility that could play an important role in strengthening pandemic preparedness, prevention, and response, particularly in developing countries and low and lower middle income countries. Now, this doesn't mean that existing institutions, don't have an important role. There's a complex web of existing financial institutions, including the multilateral development banks, the Global Fund, Gavi, and other institutions that are engaged in health system strengthening and in pandemic prevention, preparedness, and response. And these institutions must be supported, reinforced, and strengthened. For the World Bank, our health system strengthening is core to our work, to our mission. We have an active portfolio of $30 billion invested in over 100 countries that focus on health system strengthening. IDA, which is our window, our fund for the poorest, is has just, with generous support from donors around the world, has just replenished, has had a successful $93 billion replenishment, and there's a strong commitment in IDA to help strengthen health systems and strengthen pandemic preparedness. All of that is important. But on top of that, what we're saying is that what's missing right now is a dedicated funding stream that is focused entirely on pandemic preparedness, prevention, and response, that can really focus global attention and leadership on this important agenda. A dedicated stream that doesn't force governments to make trade-offs and choices, because often we find that money is set aside for these kinds of health emergencies, but then the next emergency comes along and fiscally stretched governments have to make choices and put money into a food crisis or a fuel crisis at the cost of investing in pandemic preparedness. So we're saying a dedicated financing, a dedicated multilateral financing institution has an important role to play. And we've made that case. And I think the case has never been clearer than it is now. The window for action is narrow. The impetus for action is now. It'll fade once the richest countries of the world are on the other side of the pandemic. So we really have to act now. We need to act fast. And our view would be, let's not make the best the enemy of the good. Let's start with a financing mechanism that's dedicated to pandemic preparedness. This is not, it's just one part of the solution. It needs to go hand in hand. It needs to go in parallel with all the other proposals that are out there. The idea of a pandemic convention is a very compelling one. And that's something that that I was very interested to hear about today. The pandemic fund that we're talking about, the multilateral pandemic fund, would be could go in parallel with all those other reforms and changes that are needed in the global health architecture. So I'll stop here, and again, thank you very much for your time and your attention.
Thank you very much, Madam, for that powerful presentation. I would now like to welcome Mr. Scott, Senior Advisor on Parliamentary Affairs at the Global Fund to fight HIV, AIDS, tuberculosis, and malaria. Over to you, sir.
Hello, and thank you for inviting me today. Are you able to hear me?
Yes, we can hear you.
And I had to ask that because it's telling me that it can't start my video, which has actually never happened to me in 2 years of this pandemic. Okay, it looks like I'm getting another message, so perhaps this will work. Okay, I'll also try to share my screen, but if the video is not working, I'm not sure that the screen share will work.
Oh yeah, it's working.
It's
Perfect.
working. Okay.
Yes, we can see your screen.
Much more important than my face. So I certainly want to start by thanking the Unite Global Parliamentarians Network and the Parliamentary Network of the World Bank and IMF, and all of the parliamentarians and parliamentary groups that are part of the International Forum on Global Health. We really appreciate opportunities like this to talk about the importance of investments in global health. And I know we're tight on time, so I'm just going to move quickly through a few slides, a quick reminder of the Global Fund's role, but then some emphasis on why 2022 is such an important year in terms of resource mobilization for the Global Fund. We did recently celebrate our 20th anniversary, and over the past 2 decades, the programs that we support have helped save over 44 million lives in over 130 countries around the world. And we're able to allocate, thanks to generous support from 58 donor countries around the world, over $4 billion every year. In terms of the 3 diseases, the way that translates is we provide 77% of all international financing for TB, also a majority of international funding for malaria, 56%. For HIV, we provide 25%, which makes us the 2nd largest funder behind the US PEPFAR program. In total, over the past 2 decades, we've allocated over $53 billion, and we allocate those funds based on income classification and severity of disease burden. So because of the disproportionate impacts, particularly of HIV and malaria on sub-Saharan Africa, you can see 3/4 of our funds goes to sub-Saharan Africa, but as many of you know, we have many of the highest TB burden countries are in Southeast Asia. So that is the region that is the 2nd largest recipient of Global Fund grants. In terms of the return on that investment over the past 2 decades, in the countries where we operate, again, over 130 countries around the world, we've seen AIDS deaths go down by 65%, TB deaths down by 34%, and malaria deaths down by 26%. Another really important thing to note, and many of the MPs who have spoken today have emphasized the importance of investments in health systems, not only for existing threats like HIV, TB, malaria, and COVID, but future pandemic threats. About a quarter of Global Fund funds every year are invested directly in strengthening underlying health systems. We do that because investments in health systems are essential for progress against HIV, TB, and malaria, because we're talking about things that other speakers have emphasized, things like a well-trained health workforce, including community health workers, strong laboratory networks, supply chains, data systems, financial management systems, other aspects of community systems. And I appreciate the emphasis that the honorable members from Tanzania and Bangladesh put earlier on the role that communities, local communities play in successfully addressing existing pandemics. But as you can also see, all of these investments are also really critical for a broad range of the Sustainable Development Goal targets. So things like increased access to primary health care, moving countries towards universal health coverage. And of course, these are all vital components of pandemic preparedness and response. And this is one of the things that we think is one of the most important lessons from COVID, which is the importance of investing in existing pandemics like HIV, TB, and malaria that are killing people now and harming economies now. Those investments are what prepare us to be ready when future pandemic threats emerge. But we certainly all have to acknowledge that the impact of COVID has been severe. You see a summary on this page. In the countries where we operate, in 2020, which is the most recent year that we have complete data for, we saw HIV treatment access actually increase by 9%. So that was a major accomplishment given the challenges of COVID. But we saw access to HIV prevention services go down by 11%. In 2020 relative to 2019, HIV testing went down by 22%. TB treatment, even though we have 4.7 million people receiving TB treatment in the countries where we operate, in 2020, that's an 18% decline from 2019 to 2020. That's 1 million fewer people receiving TB treatment. We also saw an increase in malaria deaths and about a 4% decrease in access to malaria testing. We did respond quickly and early in 2020 at the Global Fund, and over the course of 2020 and 2021, we were able to raise and allocate about 4.2 billion additional US dollars on top of the core funds that we allocate every year to assist over 100 countries around the world with their COVID responses. And the Global Fund is now the primary funder in low and middle income countries for all of the non-vaccine components of the COVID response. So just like we've talked about vaccine inequities, we've also seen inequities that need to be addressed in terms of the non-vaccine components like testing, treatments like medical oxygen, personal protective equipment for healthcare workers, and so forth. The reason that this year is so critically important for the Global Fund is that we raise funds in 3-year grant cycles. Every 3 years, we raise funds for the next 3-year grant cycle. We refer to these as replenishments. So, for example, 3 years ago in 2019, we convened our 6th replenishment. We raised just over 14 billion US dollars from 58 donor countries around the world. That was a 15% increase. This year, we have started the process with what we refer to as a preparatory meeting. That's how we start every replenishment year. And our preparatory meeting was hosted in February by 5 African heads of state from Senegal, Rwanda, Kenya, DRC, and South Africa. And at the preparatory meeting, we launch our investment case with a fundraising target. And the way we develop that investment case is we work with technical partners like WHO, UNAIDS, Stop TB Partnership, Roll Back Malaria, and they determine the overall needs for the 3-year grant cycle. So it doesn't come from the Global Fund, it's from technical experts. And the estimate for the next 3-year grant cycle is that 130 billion will be needed. The Global Fund has typically addressed about 14% of the overall needs. And this was true going back into the 6th replenishment and before. So 14% of 130 billion is 18 billion US dollars. That is our fundraising target for the 7th replenishment. And you see here also in our investment case, it outlines additional targets in terms of increased domestic financing for health. This is an area where political will and political leadership from leaders across all the countries that receive Global Fund grants, particularly parliamentarians in sub-Saharan Africa. This is an area where we've seen great success over the last decade, increasing domestic financing for health, but we need to continue doing more. We have something called a co-financing policy where we hold back a portion of every Global Fund grant. It's usually about 15%. We hold that back until certain thresholds are met in terms of increased domestic financing for health in countries' budgets. And so, for example, in the last 3-year grant cycle, we saw that those amounts raised from co-financing increase by 37%. So if we achieve our 18 billion fundraising target, these are some of the metrics, some of the results that our technical partners have outlined would be produced. I won't go into detail. I mean, you see an estimated 20 million lives additional lives that could be saved. All of this is described in great detail, including support justifications for these numbers in the investment case that is on our website, that also outlines all of the details behind the fundraising target. But another thing that you'll see in the investment case is a description of the really significant return on investment that is produced by investing in health systems in global health through the Global Fund and other partners. And these returns on investment are actually even greater this year than in previous grant cycles. And that's because of all the benefits associated with making up the ground that has been lost during COVID to get back on track towards the 2030 SDG targets. And I'll just end with some good news and a challenge. Our 7th replenishment, which is being convened this year, hosted by the United States under the leadership of President Biden later this fall. The United States has historically been our largest funder, providing about 1/3 of Global Fund funding overall. The United States, in the president's budget that was just released a few years ago, has already committed to provide $6 billion over the next 3-year grant cycle. And that is a 30% increase. That meets the US portion of the full 18 billion target. But there is a requirement in the US, and this is in legislation by statute, that every dollar that the US contributes to the Global Fund needs to be matched by $2 raised from other donors. So that is our challenge now, going forward through 2022, building towards our replenishment conference in the fall, is to work with all of you and your colleagues in Parliament to build political support, build political will to achieve those fundraising targets that are in the investment case. So again, thank you very much for this opportunity. Whether it's today or at any point in the future, I'm always available to answer any questions that you have, that your colleagues have, information needs that you have about the work and results of the Global Fund. Always happy to do that. Thank you again for this opportunity.
Thank you very much, Scott. That was very, very informative. Being mindful of time, I think now we can go to a quick Q&A. And I see already have 3 hands. Sandrine, you're welcome. You can say who your question is to, or if you're giving some reflections, you're welcome.
Bonjour, quelques réflexions.
Good morning or good afternoon. A few words in French, please. I'm now taking the floor, and I want to thank you for giving me the floor on behalf of the Mediterranean Parliamentary Assembly. I'm also an MP in France. From the very beginning of the pandemic, the Mediterranean Parliamentary Assembly has shared a lot of data because we have a lot of them from around the Mediterranean and beyond. We shared crucial data on the vaccine policies, and we managed to create links between scientists and WHO. We could pinpoint good practices back then, and we had to move forward towards solutions. And I want to congratulate Jordan here, and that was the first one to vaccine their refugees and asylum seekers. And we are reiterating our call for a universal coverage to leave no one behind, including migrant populations. The UN Secretary General is calling for a global forum in 2025 to debate on that question, and I think it's crucial. We support that initiative, and we suggest not to wait 2025 to progress. 4 billion people are deprived of it today, so let's keep talking about it, about that universal coverage. It's absolutely necessary to build Pacific populations. to eradicate extreme poverty. Europe and Africa have centers for prevention and control of infectious diseases, and we have to support their institutions and their interinstitutional dialogues. What more can we do? Well, we can call for an increase of national budgets, public health, make sure that it is a real priority in terms of budget, and more research and development, more collaboration between universities and research centers in the world, and cooperation between public and private sector, and make sure that the different policies of development and neighborhood also talk about those questions to make sure the Global South is not left behind. The parliamentarians have a crucial role to play to make sure that the health systems are more robust and resilient and ready to face a new pandemic. In our region, we have to be very careful, make sure that conflicts, political instability, and economic crisis don't put health at the very bottom of the political agenda. The COVID-19 pandemic and the Russian invasion reflected the deep inequalities existing between the health systems throughout the world, and we have to prepare for the future crisis that will make us adopt a more holistic, a more global approach to global health. We will have to prioritize technological solutions to make sure that everybody has the necessary tools to face infectious diseases such as COVID. And to conclude, please allow me to welcome the adoption of a protocol between our network and Unity to make sure that all the parliamentarians are informed as good as possible about all the topics we are debating on today. And by uniting ourselves, we will manage to create the necessary conditions to fight the pandemics. The real life crisis we are living through really make sure that we have to unite. Thank you very much.
Thank you very much, Madam Sandrine. Now I welcome Honorable Pierre, but kindly take about 2 minutes. And then after Honorable Pierre, it will be Paul.
Merci beaucoup.
Thank you very much. My name is Pierre Fongbo Ngayap, and the interpreters will do their best, but the sound of the speaker is really difficult. I'm a member of the Parliamentarian Assembly of the Francophonia, and also of the Global TB Caucus. It is the global network of parliamentarians on TB. I'm co-chair as well of the TB Caucus for the French-speaking area, Europe, Africa, America. One of the observations that has to be taken into account in the preparedness and response to the next pandemics is to implement systems in order to avoid forgetting the previous pandemics when we mobilize ourselves to address current pandemics. And we are losing the speaker completely. He has been muted, apparently.
Maybe. Okay, we will try to write him a message. I see he's back. Honorable Pierre?
Yes, I'm back. I think I'm
Okay,
I'm
you
back.
can continue. Thank you.
Oui. Dans la première observation principale,
So the first main observation is that implementing a global system that does not put in the backside the previous pandemics. Second important observation is to make sure that parliamentarians take part right now to the negotiations on the next pandemic treaty, because parliamentarians are at the heart of the political process. When a treaty will be negotiated, parliamentarians will have to ratify it. Hence the importance of the involvement of parliamentarians so that they are aware of the design of that treaty. Once a treaty is being ratified, parliamentarians make sure that they are implemented During the implementation of internal missions, parliamentarians must have the means to control the government action and therefore have the right budgets to do so. And we are constantly losing the speaker. We are doing our best. It is of the utmost importance that parliamentarians are associated to the treaty process.
I think our speaker is having issues with the mic, but I think in the interest of time, we can go to Honorable Paul as our last contributor, and then we'll go back to our distinguished speakers, panelists rather.
Thank you very much indeed, Madam Chair, for that. I just want to raise one issue, strongly supporting Priya Basu and the World Bank's initiative and work in this area of pandemic preparedness by stressing the importance, and we've seen it in the course of this pandemic, water, sanitation, and hygiene agenda. I think this is often overlooked when we look at the issue of pandemics, but the reality has been during COVID and has been in other pandemics that hand washing, simple hand washing, is one of the best protectors of public health. And I speak, Chair, as a former junior health minister in the United Kingdom and a former cabinet minister as chief secretary to the Treasury in the United Kingdom. I now serve in the upper house, the House of Lords, on the International Relations and Defense Committee. And what I have learned in the course of my experience is that unless we tackle the issue of water, sanitation, and health, unless we give the focus we need to give as part of our pandemic preparedness onto SDG 6, then we are missing a very real opportunity, because the reality is we've seen in the course of this pandemic that cities have been hugely important. Cities have been grossly affected by the pandemic. The number of people living in cities without clean water has in fact increased by more than 50% over the past 20 years to now 615 million globally. So we're actually getting worse, not better, in that area of water and sanitation at a time in which, because of climate change, the seas are rising. Climate changes have led to the increase in the number of people actually living in urban slums. And these slums, these informal settlements, are crucibles for pandemics. It's where pandemics spread most rapidly. In another part of my life, Madam Chair, I am chair of an organization called Water and Sanitation for the Urban Poor. We work in 7 African countries and indeed in Bangladesh. So we have seen the way in which any failure to address water, sanitation, and hygiene because of other budgetary pressures can only make worse the state of our cities and our countries when it comes to being prepared for future pandemics, as well as tackling this one. So I just want to bring forward the issue, the simple issue, but very complex in terms of delivery. It requires regulators to work closely with governments and the private sector. I just want to raise this issue of water and toilets, very, very important, and integrating them into all our plans.
Thank you so much for raising that. And as you were speaking, Honorable Paul, I was reflecting how it is here in Tanzania, and the issue and the importance of hand washing, especially when we're saying, the most vulnerable groups in pandemics are students. But how do we ensure that we have clean and safe water in our public schools, especially in developing countries? And then the issue you raised about urban slums and it's very critical. And one thing that I wanted to add, even with this COVID-19 pandemic, and this is where I would also like to get Priya's thoughts on this, is how do we also ensure that we have, you know, tailor-made solutions for peripheral regions. I say peripheral regions, for example, in Tanzania, I come from Kagera region, and we are bordering Rwanda, Burundi, and Uganda. And there's a daily flight from Kagera to Dar es Salaam, which by road is about 2 days, but there's a flight every day. So if there's an outbreak in a peripheral region, although it's far away, it's so easy for the spread, you know, to go across a larger area. So how in this current COVID-19, but even in the preparedness efforts, how are we ensuring that we also look at supporting peripheral regions, which oftentimes are underdeveloped? And another question that I wanted to pose, I think it could be either to you, Priya, or to Scott. During the pandemic, at least I know in developing countries, most of us resorted to self-prescription. And we use a lot of unnecessary over-the-counter medication and antibiotics. Obviously, we all know the downside of that is the antibiotic resistance. Now, in the efforts that we are trying to develop going forward, how are we also going to empower communities to understand the dangers of self-prescription? Because there was a lot of abuse of medication during COVID, whereby we don't know what's working. You feel a bit of cough, you try and prescribe for you everything and anything. Friends tell you, take this medication, you take it all. So is the World Bank and the Global Fund thinking about this? The other issue is nutrition. I think it was very clear the power of nutrition towards prevention or preparing our bodies to fight some of these, pandemics. And I would just like to know, where does nutrition come in, the plans within, the World Bank future preparedness and prevention of pandemics, as well as the Global Fund efforts? Because oftentimes I see HIV interventions, tuberculosis interventions, malaria interventions don't necessarily have a direct link with the issue of nutrition. I think in the interest of time, maybe Priya, you can start, and then Scott can come in with a bit of reflection. Then we can go to the part where we all roll the drums for the call to action. You're welcome, Madam Priya.
Thank you so much, Nima. And I think some very important points have been raised. One is that the boundaries of pandemic prevention, preparedness, and response need to be defined not too narrowly, because as we've learned from this pandemic, there are many things that go into preparing countries, hand washing, nutrition, and indeed, that's where an institution with a multi-sectoral focus like the World Bank, is very well equipped to look at these, the connections and the intersections. So, our pandemic preparedness, prevention, response operations, the operations that we prepared to address the COVID-19 pandemic, about $157 billion worth of projects.
I'm sorry, Priya, if you can be very brief. I'm told that we've run out of time. So if you can just use a minute, and then Scott a minute, and then I do the call to action. Apologies.
Okay, sure. So just to say that, we're looking intersectorally, so we're very with you. The points that have been made, water, sanitation, nutrition, all of these issues are critical to preparing developing countries to tackle the next pandemic and to prevent the next pandemic. And the other point is, you raised the question about country tailoring issues, tailoring solutions to country challenges. Indeed, that's the model, the country-based model that we work on. We're very cognizant of the fact that one size does not fit all, and that a lot of, all of the work that we do is, driven by kind of very detailed dialogue and, analysis and discussion with countries. I'm happy to take this this discussion forward with you offline. So thanks a lot, and thanks for your time.
Thank you very much, Madam Priya. And Scott, for 1 minute.
Yes, thanks very much. Just very quickly, trying to respect the 1 minute time frame. I certainly want to reiterate our gratitude to all of the parliamentarians who have participated today. In terms of resource mobilization for global health, particularly with all of the present challenges and competing demands, there is no element that's more important than political will in terms of maintaining support for prioritizing global health and budgets. So thank you for everything that this network is doing. And certainly, Nima, you're absolutely right. Medicines and nutrition services are two of the most important elements in terms of what the Global Fund provides support for in the countries where we operate. We have a very country-driven process where in every single country that receives a Global Fund grant, we have something called a country coordinating mechanism that is made up not just of government officials, but also civil society, community representatives, communities impacted directly by the three diseases, academics, foundations, private sector, that make the final determinations about where funds are most needed. But these are absolutely areas where we hear a great deal of emphasis, particularly with TB and nutritional services. That's one of the things we hear emphasized most by TB advocates, communities impacted by TB, is the need for those services to be supported. So that's how we approach that. And thank you again for the time today.
Thank you very much. A huge round of applause for Madam Priya and Mr. Scott. And I now go to the call to action. And what I would like to say is that the role of parliamentarians to promote pandemic preparedness and response and financing resilient health system is obvious. We as parliamentarians have a role to play. But in order for, and it has become more clear with the COVID-19, the way in which COVID-19 demonstrated how fragile our health systems are, and in order to react and to prevent such episodes happening in the future, in order for us to sustainably achieve this preparedness that we are discussing here today, there will need to be some sort of regulatory framework that enables that preparedness and prevention to come into play. And that is where, again, members of parliament, we have a critical role to play. I particularly commend the Parliamentary Network on the World Bank and IMF and Unite's Global Parliamentary Network to come together and organize this very important discussion, because it has further empowered us as parliamentarians to see the role in which we play, because sometimes we tend to think this is something for the health practitioners, it doesn't concern us, but actually it does, and we're at the central of it. And again, as parliamentarians, we recognize that in the last 2 years with COVID, it somewhat shifted the priorities of a lot of our countries, and suddenly we forgot about all other diseases and the focus was just on COVID. But had we been prepared, we wouldn't have done that. So in these 2 years, where we've all been running around dealing with COVID, forgetting that malaria is still there, tuberculosis is still there, HIV is still there, what is the negative impact of that? So I think one of the things that we need to critically look at when we're designing this preparedness, we should always ensure that when we are in such a situation, we don't forget other existing health issues that are actually as important and causing a lot of deaths as the pandemic. And then the other issue, I think, as a member of parliament coming from a low middle income country, I think I can speak for my colleagues to convey our sincere gratitude for the financial incentive support that was extended to us by the World Bank, IMF, and other development countries and development agencies. But one thing that I would like to particularly share is that I think it's very important to always try not to be too prescriptive, when this support is being given, and to take in consideration the local contents, For example, in Tanzania, we were able to use the COVID relief funding received from IMF to build classrooms to ensure that there won't be congestion, to make sure there's access to water in schools and communities, So it's things like that to see how can we use the support that we're getting for tangible interventions. But again, as parliamentarians, collectively, we strongly believe that through the adherence of this new pandemic convention, the world has a chance to stop an outbreak from being a pandemic. And this is very critical, especially if all those who sign up will adhere to the non-negotiable principles, which are solidarity, transparency, equity, and accountability. It's very unfortunate that these non-negotiable principles were not adhered to even by the developed countries, which us from developing world look up to. So there in itself, it shows there's a lot of work that needs to be done. And ladies and gentlemen, my fellow colleagues, I think to conclude, I have the great honor, I was given the great honor to present to you this call to action. And as members of parliament and as yourselves as supporters, it's very important that we work together and we use the existing tools and actions to ensure that the world is better prepared for future global health threats and support negotiations of new global instruments for pandemic preparedness, prevention, and response. And this is an initiative that is being led by the WHO and its international negotiating bodies. Second, to advocate for a convention that enhances those four main principles. It's essential for all countries, regardless of the income level, the perceived power, share equal decision-making and access to equitable opportunities for preparedness, alert, and response. Third, support cohesive governance to implement public health measures that include independent monitoring and verification, as well as transparency in sharing information. Fourth, support development of substantial, predictable, and sustainable financing for pandemic preparedness. And this is something even the World Bank and the Global Fund touched on. And lastly, advocate for successful seventh replenishment for the Global Fund, including support for the $18 billion fundraising target identified. And I believe for all of this to be done, and as parliamentarians, to truly be able to advocate and influence our governments, we as parliamentarians also need capacity building in this pandemic treaty. Because in order to advocate, we need to understand it and we need to be part of it. But secondly, there's the issue of health data governance. How are we going to be capacitated to advocate for health data governance, which goes in line with the needs of things like data privacy acts. Many African countries, for example, don't yet have data privacy acts. So there's a lot of things I think holistically we need to look at. But all in all, I personally, and I'm sure my colleagues, my fellow members of parliament, endorse this pandemic treaty. And we hope that you will support us in implementing this call to action. And I thank you all for being part of this call. And I look forward to discussing with you all further on this discussion. And to be honest, it's very refreshing to see that an opportunity is being extended to a member of parliament from a developing country, which oftentimes we don't get to, we don't get the chance to be at these decision-making tables, although most of the things that are being discussed affect us the most. So I'm very, very humbled, and I thank you very much, and I wish you all a great evening or afternoon or morning or wherever it is that you are. But thank you very much.